Well, in an effort to stop the massive fraud and abuse in state social services programs, the state started shutting several of those programs down. But there is a new allegation that an innocent person who needed adult daycare services died as a result. Here's Lou Raguse with tonight's top story.
Julie, according to St. Paul Police, 60-year-old Ronnie Williams was found dead in the apartment where he received integrated community supports. He received those services from a provider whom DHS froze payments to as part of a fraud investigation. And advocates say innocent people like Ronnie are suffering as a result.
Good morning. I call the House Prevention and State Agency Oversight Committee to order.
The latest at the legislature's Fraud Prevention Committee hearing, suspicion of kickbacks paid by fraudulent adult daycare providers to steal clients from each other.
Because when you have a marketplace, when there's excess capacity, there's not a way for you to drum up legitimate business, then you're going to try to figure out if profit is your motive, you're going to figure out ways to drum up illegitimate businesses.
It's just absurd.
But before the hearing, allegations of unintended consequences of the Minnesota Department of Human Services crackdown on fraud.
The system is failing, and now people are dying because of it.
Josh Berg, a Twin Cities provider of integrated community supports, says DHS cut off payments to a fellow provider because of suspected fraud, and as a result, a legitimate client of theirs died when the services stopped. Berg accuses DHS and the Walz administration of not helping vulnerable people receive continuation of care in these situations.
There is no plan in place. There is no coordination happening. There is no thoughtful plan that has even been developed and rolled out.
KARE 11 News confirms 60-year-old Ronnie Williams was found in this apartment on St. Clair Avenue in St. Paul, where he'd been dead for days. He previously was a client of Relief Health Services, LLC. ICS services include making sure clients take their medicine and eat.
We need to have protocols in place so that when these situations happen, there's no disruption to care.
DHS Acting Commissioner Shireen Gandhi says the state is helping those people. She says they coordinate with the client's case managers to try to move them to a different provider when they shut off the money to the current company.
Our team works with their team to do everything we can to get people transitioned into settings where they are going to get the care that they deserve and that they need.
An attorney from Relief Health Services, LLC told me they are not commenting yet. Our data shows that company had explosive growth over the last 3 years, going from $11,000 in Medicaid billing to $2.3 million last year. But they have not been charged with fraud-related allegations. The medical examiner hasn't released Williams' cause of death, and St. Paul Police are still investigating that.
So it's a little confusing because even though people are committing fraud, maybe by overbilling, sometimes they are providing some care. And DHS is saying we take care of them when we shut these things down, but they're not.
Well, absolutely. So in this case, the provider is not accused of any fraud other than the fact that DHS says there were credible signs of fraud and they stopped the payments to them. But they did for sure have real clients such as this guy. Now what happens is they need to get to a different provider, but DHS in an email to me said that this company could still continue to bill and provide the services, and if the payment is lifted, then they would get paid for it after the fact.
All right. All right. Thanks, Lou.
Yep.